I'm Dr. Shasidhar Reddy, the consultant physician and also the associate professor of internal medicine. Today, I'm going to discuss the lifestyle diseases. In present scenario, the lifestyle diseases are increasing more, especially the diabetes and hypertension. So basically, the diabetes and hypertension, obesity, dyslipidemia, all these are called metabolic syndrome. These are all occurs due to the lack of physical activity, high stress levels. All these are common. So in present scenario, the olden days, the TVs are bigger in size, the humans are now smaller. But in present scenario, the TVs are become smarter and smarter, has become very thinner, but the people are become obese. So this is the trend. So for that, we are going to discuss the topic of hypertension today. So basically, what is hypertension? So the heart will pump the blood into the blood vessel wall, and this will create the pressure against the vessel wall, which is called blood pressure. The normal blood pressure is 120 by 80 millimeter of mercury, but if a person is having more than 140 by 90 millimeter of mercury in a two separative readings, then we used to call as hypertension. So basically, what are the symptoms of hypertension are? The patient may have headache, blurring of vision, and buzzing in the ears, nausea and vomiting. But sometimes the patient may not have the symptoms. That's why it is called silent killer. So this disease can damage your eyes, can damage your heart, can brain and kidneys. So what are the risk factors and how we can overcome this hypertension? Basically, the risk factors are like, one is age. As the age advances, the blood pressure is increasing due to there will be a loss of elasticity of the blood vessel wall. This will lead to stiffening of the vessel, and there is a fat deposition due to atherosclerosis, which will lead to narrowing, and there will be turbulence of the blood flow. So this will lead to the hypertension. Second one is, any patient who is more than 40 required a regular monitoring of blood pressure. But if any young patient who presented with hypertension to the clinic, you need evaluation. It might be due to endocrine causes like Cushing syndrome, Conn syndrome, pheochromocytoma, or renal artery stenosis, or hyperthyroidism can cause hypertension. And coarctation of aorta also important. That's why any young patient who presented to the clinic with hypertension should check blood pressure, should check pulse in the upper limbs as well as in the lower limbs. And coming to the second point, the family history. If someone having hypertension in the family, need a regular blood pressure monitoring. So if someone having the hypertension in the family needs a regular monitoring of blood pressure. And the third one is the diet. So what is the diet? So basically, the excess salt intake and low potassium diet can lead to development of hypertension. So for that, we need to follow the DASH diet. So what is DASH diet? Is dietary approach to stop hypertension, which will contain the excessive vegetables, fruits, whole grains, pulses, and low fat diet. So which means we should avoid the processed food like dry fry items. We should avoid the pickles, and we should avoid the papads. So this is very important, and we should take a low fat diet, dairy products. And coming to the exercise, so everyone has to do the regular exercise, 30 minutes per day, 5 days in a week. That means around 150 minutes per week. And the exercise should be in the form of walking, brisk walking, jogging, swimming, playing badminton, cycling, and dancing also is one form of exercise. But before doing any exercise, you should consult your doctor. For that, we should look after the other comorbidities, and based on your heart function, your doctor will suggest what type of exercise will suit for you. And coming to the fourth point is, we should avoid stress. So in the form of chronic stress can lead to hypertension, like yoga, meditation, and pranayamam. All these things can reduce your stress levels. And final one is adherence to medicines. You should take your, once the BP is more than 140 by 90, your doctor will prescribe the antihypertensive medication. You need to take medication very regularly. Adherence to the medicine is very important, taking pill, because if you are taking pill daily, if you are controlling the blood pressure, your eyes, heart, kidney, and brain will be protected, and you can increase your lifespan. So stay safe and stay healthy. Thank you.